My name is Maury West, and I am the chair of the ASA Insurance Committee. Right now, there is a major issue happening with Regents, and my committee is not scheduled to meet for another 2 weeks or so. So I am sharing information that I have gathered and I've given to members of my network. I want to share it with you and the Oregon Association because I believe the sooner we start getting it fixed, the faster you'll be getting reimbursement again. I've uncovered some items in the processes that Regents is using that are, in my opinion, incorrect and misleading. I've created a toolkit and I'm sharing it with you all. And it starts with this letter of explanation of the situation. Because if you're not aware of it and you're wondering what am I talking about, I'm talking about denials that started happening sometime in August for manual therapy and infrared codes, 97140 and 97026. There may be others. Those are the ones that I was aware of. And the explanations given by Regents make no sense. Let me explain. So what I showed you was just a page of my toolkit, and now these are the denial remarks that are showing up with the denials that people are receiving. And they started receiving these in mid-August. If they used a modifier like 5.9 or even GP, they would get the first denial, inconsistent with a modifier used. And these were modifiers that they had previously used the week before or so and were paid. It's my opinion that it's not the modifiers. I actually don't think this carrier requires modifiers. And I think that what happened was if they don't require modifiers in the past, they just ignored them. So providers who didn't use modifiers got the second denial, procedure incidental to the primary procedure. Once I saw that denial, it all started making sense. In my mind, they have to have done something in their database which caused the codes to reject. When that happens, in some cases, you can use a modifier to override what would normally be denied. And so that's why people got the first denial if they used the modifier. An example of what I'm talking about is E&M codes always require the -25 modifier. And then without it, they're definitely not paid. With the modifier, they're at least considered. I then told providers that they would have to appeal these denials. I said the sooner we get the appeals in, and so this appeal that was sent didn't have enough background documentation. I'm appealing the claim per the denial. Benefits were included in the data service and necessary. It's not a necessary issue. What happened was we didn't give them enough data for them to understand. And let me just tell you what happens. When appeal is sent, the response, if you don't spell it out for a carrier, it's always, we were right. We didn't do anything wrong. You're not giving me any reason to repay this claim. They don't do a deep dive down unless you give enough reason to do it. Hence this little presentation. So the second remark code, if you notice, said this claim was processed through the correct code editor. So I started there. I went to their website and found their archive and their instructions. And what you see is they spell out exactly where they get their information from. They use CPT Assistant. That's a subscription service by the AMA who owns the CPT codes. And it's official guidance and clarification of codes. I've been a subscriber for a long time. Then they also use the HCPCS manual. That stands for it stands for Healthcare Professional Coding System. And that we call it HCPCS. HCPCS codes are owned by CMS. And so it's a completely different code set. You may not even know about it because it's only used for devices. So to make a long story short, in a nutshell, they use CMS, Center for Medicare and Medicaid Services, also known as just Medicare, and they use AMA. Now, I will tell you that there is nothing in the CPT Code Advisor, in the AMAs, that that gives them any authority to deny these codes. Nothing. This is a mistake, but I needed to find the data to show them the mistake that they made. So I dove into their editor a little more deeper. 429 pages of codes and codes and codes. It took me a while to find the acupuncture codes, but here they are. You see they're listed with component codes. Now, component typically means a service that's bundled into the primary service and should not be billed separately. What you'll see is the first 30 codes are all physical medicine codes, and a number of the codes, manual therapy, massage, uh, therapeutic exercises, infrared heat lamps, those are all in your scope of practice and should not be listed at all. The rest of them are also physical medicine codes and HCPCS codes, but the physical medicine codes don't make any sense because they would never even be, a lot of them would never be even be used by an acupuncturist. If you look at code 97761, that's for prosthetic training. When a patient is fitted for a prosthetic device, definitely not a component of acupuncture. Now, it gets even a little weirder when you go down to the HCPCS codes. Those are the ones that start with an A. They clearly have nothing to do with acupuncture. The very first HCPCS code, A6010, is for a collagen-based wound filler. The rest, just as ludicrous. This is where the ASA, Insurance Committee, and the Oregon Association will work with Regence to confirm that not only are they updating their correct code editor, but also that it's correct. Now, if you look on the right side, you see rationale. You'll see maintain CCI logic, and you'll see the term NCCI policy. This refers to CMS. CMS has what's called a correct coding initiative, and their complete list is called NCCI policy, National Correct Coding Initiative. That's what they claim, Regence claims they're using for their correct code editor. But they aren't, obviously. So let's look a little further in the rationale. They also mention the NCCI policy manual in chapter 11, and they talk about CPT HCPCS text definition. So I didn't want to and can't really show you the whole manual, so I want to show you that chapter 11 table of contents. Acupuncture isn't even listed in the chapter. This is what they're using as a rationale. You will not find acupuncture anywhere listed in any of this. We're going to be bringing that up to Regence as well. For the record, this is what an association does. It's an opportunity. We want, in a sense, when there are opportunities like this, for engagement, for dialogue, we want to work with them and help educate them and have a discussion about the acupuncture profession with them. Oh, so I kept doing my research. And what I did was I then looked at the national coding, their actual official national. There's nothing in their policy book. Now let's look at their coding initiative. This is a huge document. But I will tell you, it's standard in this industry. It starts at the TOP, and the very top is Medicare. And most of the carriers will utilize Medicare policies and procedures as their own because of the amount of research that Medicare puts into creating these types of programs. I didn't really want to go through that document because it's a spreadsheet that's pages and pages long. So in my research, I found a Medicare contractor that has a lookup where you can put in one code and see just those codes that shouldn't either, and you'll look down here, either if it's a 0, it would mean they're always bundled. Do not submit a modifier. There are no exceptions. Or it'll indicate that exceptions may apply, like the E&M example I gave you. But note here it says documentation is required in the patient's medical record. And so if you're getting denials for E&M, just a little tip, and you've been setting records, and those records were good records, I mean, standard in the industry type records, you would have gotten paid. Unfortunately, people are assuming that there is no longer coverage because when the ones that have sent their records, those records were deemed substandard or insufficient, and so they never got paid. Finally, you'll see nine, and it means that they don't even go together. There's no modifier needed. You don't see too many nines because they don't even bother to print it. If it's not necessary, it wouldn't be. So I utilize this contractor's procedure lookup, and on the left-hand side, you'll see my results. I searched for 97810, and these various codes came up. And if you'll notice, between 96523, which is not allowed, it's in numerical order. We should see if they really were using NCCI edits, we would see those codes there. But we don't. But we don't. Because there's been a major issue in their processes. Now, I went over to the dry needling codes just to see. And this is the information that I got back. And you'll see that they have the 0, not allowed. That means that you cannot, and we've known this, you can't bill dry needling codes at the same time you bill acupuncture. Now, those are the codes 20560, and there's also 20561 for dry needling. Those are the ones that should have shown up in Regence correct coding error, but we didn't see those codes, did we? So finally, here's the kit I put together for you. It starts with that overview letter explaining the issue. If you forget what I'm saying or you don't watch the video, you'll have an understanding of that. Then I went on and showed background information, as well as I created a template for the appeal with wording that if you send in along with background documentation, we're hoping they understand. No, we're not hoping. I'm 100% certain they'll realize it once enough letters go through, our letters and the association letters. Once they start to receive it, I'm sure they're going to change their processes. At that time, I'm going to tell you what I anticipate happening. Anyone who set an appeal will get an official letter back. And because that's usually how they do things. They'll say, we've corrected the issue and we'll reprocess all previously processed claims. People that didn't appeal should also see reprocessed claims getting paid. But honestly, I have always advised keep an Excel spreadsheet of all dates of service. And so when they do acknowledge their mistake and reprocess, you're confident. If you don't see yours getting reprocessed, sometimes that happens too. You have the data to go ahead and say, I understand you've updated this, please reprocess these claims. I'm truly confident of the outcome. And part of the reason I'm even here right now telling you is if any of you are also VA providers for the VA CCN program, you've already gone through one glitch. And this is what we call it. We call it a glitch. We have seen this earlier this year when it was a similar issue. They denied E&M codes that were authorized. And once the carrier was made aware of the situation, they dealt with it just like I'm going to tell you they're going to deal with this. It's funny, too, because I actually talk about glitches in my most recent newsletter, and we typically don't see two of these things that affect one area of the profession. We usually don't see even two in a year. So I just want you to be aware of this. I see on social media people giving advice, or mostly they just complain, this is why I don't take insurance. And honestly, I can't promise you that carriers won't have glitches. I will tell you, I kind of can tell you when they'll happen. They usually happen when a change is made, when CPT codes are updated, when they updated this. I'm sure it happened in relation, they updated their database, which automatically started kicking out claims. So what I want you to do is be proactive about this. Don't complain. File an appeal. Get the money that you're entitled to. At the same time, the National Association, along with your association, will be working hard with Regence, and we're going to use this as an opportunity for education. So it's a lot to take in, but thank you so much for listening to me.